beautiful audience over there. All right, summertime is the time to show off the legs, not cover them up. So if you're struggling with spider veins, maybe varicose veins, we have Dr. Robert Thompson with Vein Tech here. We have some good news for you today. Dr. Thompson, thanks for being with us today. First thing I asked you when I saw you on the couch, I said, am I going to get varicose veins by crossing my legs? Am I?
No, it's an old wives' tale.
It's an old wives' tale. Isn't that good news? I was so happy to hear that. So happy to hear that. So let's talk about spider versus varicose veins, because is there a difference between the two?
A big difference. Spider veins are primarily little small vessels in the skin. They're a cosmetic problem, not necessarily a health problem, but people don't like the way they look. The big veins or the varicose veins, that's actually an abnormal vein from too much pressure, too much standing, a lot of pregnancies. Those are the ones that lead to blood clots and skin problems, but the big difference in how much health problems they cause.
So are varicose veins more ones that maybe bulge out rather than just kind of showing on your legs?
Those are the ones that really protrude out the skin.
So what are they caused from? I mean, are spider veins, which are what you said the cosmetic ones, are they genetic? Where do they come from?
Some of it's genetic, some of it's hormonal, some of it is just a lot of pregnancies, a lot of time on your feet. The blood pressure gets too high in the legs, and so all the blood gets pushed out to the skin.
Now, should you be, medically concerned if you start seeing that you have varicose veins? Or is that something we can come to you and get it taken care of?
Oh, varicose veins are the end stage of that disease, so those should be treated.
Okay.
The spider veins basically is just a matter of how much it bothers as far as the way it looks. Sometimes they can itch and burn, but the big veins are the ones you want to take care of.
I was asking him earlier as well. I said, do you get a lot of folks coming in the summertime going, doctor, please help me? But you're saying no spring, because then they start wanting to prepare for it.
It's a several-week process to take care of them, so you can't come today and say I'm going to go on a cruise tomorrow.
Yeah.
But if you give a few weeks ahead of time, we can get things looking pretty good before that.
So let's talk about some of the treatment options you have, because I understand there's a couple of different approaches you take.
The spider veins are treated with injections of a chemical that makes the vein just shrivel up so the blood doesn't get into the vein anymore.
Okay.
Everybody asks where the blood goes. Well, it goes away from the skin into the deeper veins.
Okay.
The varicose veins need to be treated by either a laser if it's a long, straight vein that shrinks the vein by the heat, or we can actually remove the vein.
So it sounds like spider vein treatment might be a little less invasive, a little less downtime. How much time should someone give themselves to take care of their spider veins?
Spider veins will take between 2 and 4 weeks to totally go away.
To totally go away, and will they come back? What are the chances of having to come get retreated? Obviously, they'll probably pop up somewhere else, maybe.
Yeah, you can get some other places. The ones we actually treat, it's pretty rare for them to come back.
Oh, that's good to hear.
And then the varicose veins that we remove, they'll never come back.
Never come back, because you're completely taking them out. And is that safe to do that, to take out veins completely?
It's much safer than the old days where you heard of the vein strippings that you used to do in the hospital. Now we do all this in the clinic. No downtime, people go back to work the same day or the next day, and it's no hospitalization, local anesthesia, so it's a lot less risky than it used to be.
Now, when we compare spider veins and varicose veins, does it take a longer process to kind of make them go down or whatever when you're treating? Because you said spider veins took like 2 to 3 weeks.
It's about the same period, depending on how big the veins are and how many of them there are.
Is it painful at all?
Not having done myself, I can't say that, but we don't get very many complaints of pain. Most people get by with just some Advil or Motrin or something, and there's, like I said, it's local anesthetic. And most people, I've had people go back to bike riding and jogging the next day.
What are some of the responses you get from your clients? Because I imagine, do you hear back from them after saying, thank you so much?
That's exactly what they say. They said, I wish I'd done it sooner, or my husband says, why did I wait so long? But basically, my legs feel so much better.
It's kind of one of those things you're probably intimidated by it when you think about it, then you actually have it done, you go, why didn't I do that sooner?
Yeah, most people, now that you don't have to go in the hospital to do it, they're willing to do it. And it makes them feel a lot more comfortable that way.
Yeah, well, this is really important information. I know it's good news for a lot of folks out there, because many people struggle with both spider and varicose veins. So if you have some questions, give the doctor a call. He has 2 locations, 19141 there on Stone Oak Parkway, that's Suite 401. Also one on Medical Drive, that's Suite 100 at 4330. Veintech.com, lots of great information there as well. And we'll have that on our website, kens5.com. Thanks for being with us today. Making our legs look good.